Hello, my name is Dustin Anderson. I'll be talking a little bit about whether or not I would use diagnostic or treatment algorithms in my clinical practice. I see myself using both diagnostic and treatment algorithms moving forward in my clinical practice. When I first started looking at them and having to use them in the setting that I'm in, I was a little hesitant because I didn't think they would be that good. I sort of thought that they took away from clinical evaluation. But the more that I've used them, the more that I realize it's just a tool. It's not an end all be all, but if you have a patient that fits a certain criteria and the diagnostic algorithm's been shown to be a good predictor of that pathology condition or anything the patient's presenting with, more than likely the patient has it. So it's good to have that laid out plan of care for that patient. With that being said, not all patients will respond the same way to the treatment or diagnostic algorithm. So that's where your clinical judgment has to come in, and I think that's where the diagnostic and the treatment algorithms come in as a good tool for athletic trainers. Um, I think when we had to make the especially the diagnostic algorithm for class, the hardest part for me to do, and I think I really didn't get out of it till I got the feedback from it and everything else, was we look at X, Y, and Z. If they have this and this and this and this is what we need to do. But diagnostic algorithms provide more of an in-depth roadmap as opposed to just taking a subjective evaluation or evaluation. It's I think it's more of a good guide of the road you need to go down. I know when I first started clinical practice, I feel like I wasted a lot of time with evaluations and treatment, and I think the diagnostic and treatment algorithms provide a way to cut down on that unnecessary loss of time by providing again that map of where you need to go so you can direct care, you can direct the patient to wherever they need to go. If they need to go see a general physician, they need to go see an orthopedic physician. Wherever they need to go, you can use that treatment or diagnostic algorithm as a way to justify what you're doing. And it's also a good way to explain to the patient this is why you're doing what you're doing. I know where I work, we use the auto ankle rules uh, quite a bit, and it helps me when patients don't want to go get up to get an X-ray or be put on crutches to miss training. You bring out the auto ankle rules, and you can actually show them you have pain here you're unable to walk, and what we need to do is put you on crutches, get you an X-ray, and see if there's a fracture. If there's not a fracture, that's great. If there is one, we don't need to be walking on it. We need to let you heal up, and you can get back to training. And I think that was a good I think that's a good example of how I use diagnostic algorithms to help me explain things to my patients in clinical practice, because sometimes it's hard to explain what's going on in your head as far as why you're doing the treatment or why you do your evaluation the way you do. I know as I got more experience as a clinician, those discussions became easier. But I think as young clinicians, if you can follow those treatment and diagnostic algorithms, patient buy-in might be might be improved by using those. Um, Overall, when I first started clinical practice, I was hesitant. I sort of bucked using diagnostic and treatment algorithms. But the more that I go through the process of becoming an advanced clinician, I'm not there yet by any means. I feel like I'm more like a mid level clinician, but working towards that advanced status. I see the utility in diagnostic and treatment algorithms, and I look forward to reading more about them, using them more in clinical practice, and hopefully can be a good advocate for the use of those two things in athletic training. hopefully I've not rambled too much, but those are some of the reasons that I think that diagnostic and treatment algorithms can provide a benefit to clinical practice. Bye.